Hello everyone, I'm Dr. Aditya Chakravarti, and today we'll be discussing about what are the reasons you should not choose cardiology. In my previous post, I had posted the reasons why you should choose cardiology as your specialty. In this video, I will be looking into the cons of choosing cardiology. The first thing why you should not choose cardiology is the cause of radiation. See, before joining cardiology, there are so many seniors had given me so many ideas like what about the course, but none of them had given me any importance for this radiation. After doing 3 years in my residency, I've come to know that the radiation that we receive as a cardiologist is the maximum in comparison to any other specialty. Because most of our procedures are done under fluoro, and fluoro, I mean, you get continuous radiation for a lot of period. We have our main cath lab days where we end up doing some 20 angiograms and some 5-6 plasties. By the evening, you can feel being fatigued. The radiation takes a toll on your body, and you feel so much fatigue. And once you go back and lie down, you just sleep off dose of the entire night. So the radiation dose, it's not just going to be limited to the residency. It's going to be there till we practice cardiology. So the amount of radiation and the long-term effect of these radiations is not known. Like we are not sure of what is going to happen after 20-30 years of exposing to such high radiations. See, we are exposed to radiation at an younger age in comparison to our seniors. Like they were starting getting exposed at a little later age when they're in 30s and 40s. Like now we are getting exposed in our early late 20s. So 30 years of radiation exposure, we don't know where it's going to lead to us. So that is one significant risk factor before choosing cardiology. And second thing is that we have to wear heavy lead aprons. So that is going to create some back pain, and a lot of my seniors are having that back pain issue. So that is also going to be there. So this thing you definitely must know before choosing cardiology is that it's a radiation prone field. Second thing, as we all know, it is somewhere you don't get sleep. It's a sleep deprived branch. So residency is obviously going to be sleep deprived, but even after residency, even after becoming a consultant, see, at night at any time a patient can come for STEMI. So you have to take him for primary PTCA. If you can't go ahead for license, you will have to do a primary PTCA. So invariably you will be sleep deprived. So you can choose not to do emergencies, and you can choose a better life, but majority of us don't go that way. Majority of us are sleep deprived, and the sleep deprivation is going to be there till our late 40s. Till you become a senior consultant, you will have to be sleep deprived, and this is not a field where you can work 9 to 5 and go and relax. This is a field where you have to be committed. Even during nights have to be committed, days are committed. So that is how it is, and that is there. Third thing is that the stakes are always very high. See, at any time you will have to face death every single day. That is, in any high volume center if you work, you will invariably have to face 1 or 2 deaths every day. And also you have to know that this anything can go wrong at any time. Say if a wire perforates, or if the patient goes for slow flow, you have very small time before you could do something and recover the patient. It's going to be just 1 or 2 minutes. So you have to be highly skilled and fast to recover the patients. Even non-caths, the patients can go for VT at any time. Ruptures can happen at any time. So you will invariably face deaths, despite being protocol-based management. Still, you will have to face deaths, and you will have to face the attenders and explain the deaths. That's going to be there throughout your field, and it's going to be there every single day. That is what he said. So the stakes are very high, so you should be ready to have face those high stakes to choose cardiology. And the other part is that this is an interventional branch. This is the fourth point. See, by interventional branch is just like any surgical branch. You need a high volume center. You need good hands-on before you can be confident enough. So for a coronary intervention, you should have done at least some 500 plasties before you could be confident enough doing angioplasties. So that is there. So not all centers in India gives such good hands-on, and that is there. And even after your DNB, even after DM or DNB, you will have to work 1 or 2 years in a good high-volume center to get that hands-on. So it is not like end of 3 years you're going to be good with intervention. It's going to take some time, just like any other surgical field. It's just stepping into cardiology. That's it. So it's going to take some time before you could be good. Another thing is that cardiology, there are a lot of subspecialties after DM cardiology. You can think it as a plus, or you can think it as a minus also. See, there are so many fellowships like heart failure fellowships, structural fellowships, EP fellowships, pediatric cardiology fellowships, and and coronary interventions, complex coronary interventions. So these all things will take so long time to. By the time of you finish your DM for 3 years, you are just entering into the field of cardiology, and there are so much more domains to conquer. And again, the problem with being in metro cities is majority of the metro cities are getting saturated with cardiologists. So we will have to move to a type tier B, a tier C. So that saturation point is definitely true. So these are the things you have to choose before going to cardiology. The first thing is the radiation exposure, significant radiation exposure. Then you're going to be sleep deprived. The stakes are very high. You have to face death every day, and it's an interventional branch, so it's going to take some time to gain some confidence. And there are so many. It's a growing branch. So many subspecialties are coming out every single day. So that is also is there. So you have to know all these things. But despite all this cons, if you are liking the subject, you should go ahead and choose it, because it is one field that is giving as much satisfaction. Every day you'll come back, so when you go to sleep, you'll be satisfied that you have made some significant impact in a lot of people's life. So that is definitely there. But again, these cons you should be knowing before choosing cardiology. If you like this video, I would like you to subscribe to my channel, share this friends with your friends who are liking to choose cardiology, so they will also have a broad picture of what is it.